Dr. Rapp is a board-certified environmental medical specialist, and she's a pediatric allergist. You probably have heard her either on Oprah, Larry King, CNN.
Good afternoon. I'm pleased to have an opportunity to talk to all of you today. I'll show you some provocative videos as soon as we have a chance to get them in focus. Basically, what I'd like to do is talk to you about how chemicals can adversely affect your patients and how easy it is to not recognize chemical sensitivities. I practiced pediatric allergy for over 40 years in Buffalo, and I missed chemical sensitivities for years because I didn't believe and I didn't know what I know now. So I'd like to share some information with you that will help you tomorrow or today during office hours. I want to give you a lot of tips, tell you what chemicals do. There are chemicals in our air, in our food, and our water. The food that you're eating now probably has chemicals, and so does the water. In California, they have a sign in the California hotels, chemicals known by the state of California to cause cancer, birth defects, and other reproductive problems may be present in this hotel or in the food and beverages sold here. That shows how bad it's become. What do these chemicals do? They damage 4 different systems that will, and different chemicals will affect different systems, but for the most part, they all do the same types of damage. They damage the immune system, which leads to recurrent infections, allergies. You're seeing more asthma now than ever before. And the end stage is cancer, and as you know, we have an epidemic of that that's disastrous. It affects the nervous system and the brain, contributing to problems with children learning and behavior, developmental delays, autism. It affects the endocrine system, contributing to the epidemic of diabetes and thyroid disease. It affects the reproductive system in disastrous ways, particularly in relation to the male genitals when they're in utero. They can be damaged by the phthalates, which are the plastics. The chemicals are, there are something like 80,000 chemicals in our world, and the government has checked less than 10%. And they haven't checked them for nervous system problems. They haven't checked them for, if you're pregnant women, for the fetal effects. 40 years ago, with the insect damage to crops was 7%. After using billions of pounds of toxic chemicals, the insect damage has doubled since 1940 to 14%. So we aren't accomplishing what we set out to do. These chemicals are, as I said, there are chemtrails, they're spraying us with chemicals for the mosquitoes, and there are a lot of problems in relation to all of this. The EPA has admitted that 25% of genetic and birth defects are due to chemicals. Do the pregnant women know how important it is to avoid them? The 40% of fungicides, insecticides, and pesticides cause cancer. We wonder, why is there so much cancer? Why isn't there more emphasis on preventing cancer and figuring out what causes it? 30% causes reproductive problems. And I'm sure many of you are aware of the infertility problems and the sexual problems we're having now. When I went to medical school, you rarely saw autism, you rarely saw, well, we didn't see bipolar disorders very often. I don't remember seeing anxiety and panic attacks. I'm a board-certified pediatric allergist. We didn't have these behavior problems in schools where all these children had to be on Ritalin. Maybe I'm just getting old and I've forgotten, but I don't think so. So we have to keep saying, why are so many of these things happening? And I think the answer, one answer, is that there are more chemicals in everything today than we ever had before. There are many harmful exposures. One of the things I learned in my many years of practice was, I'm retired now, but when I was practicing, was that dust, mold, pollen, foods, and chemicals can affect any area of the body. It can cause arthritis, it can cause headaches. These things can cause behavior and learning problems, and I have lots of provocative videos that that show that these things happen. One is called Environmentally Sick School, which shows children and adults reacting to dust, mold, pollen, foods, and chemicals. We have time. I want to show you what happens to a woman when she was tested for a school carpet and perfume. There are many harmful exposures in your home, and to save time, I've given you a sheet that tells you exactly what's in your home, what's in the water, in the air, in your Teflon skillet, what your microneedler does, what your dry cleaning fluid does to you, what your disinfectants and deodorants do to you. We are all loaded with chemicals in our environment, I hate to tell you, but also in our bodies. And this will tell you what to avoid, and I've tried to tell you what to do. Instead of Teflon, you get yourself some glass skillets or ceramic coated skillets. They now found Teflon, incidentally, in the uterine fluid and in the breast milk of women. And there are ways to cope with all these problems, and that's discussed in Chapter 3 of my book, Our Toxic World, A Wake-Up Call. Ask yourself, why does asthma increase 42% in adults, but 82% in women? Why is it so high in women? Because they are exposed to disinfectants, deodorants, moth repellents, synthetic carpets, pesticides in their house. All these things are affecting the women in particular. At the turn of the century, it was only 2 or 3 per 100 who had cancer. At the present time, it's 1 in 2 to 3. We emphasize a lot, how do we treat it? But what I'm saying is we've got to come from the other side and say, what is causing this terrible epidemic that we have? Why do 25%, there's a 25% increase in brain tumors in children in the last 25 years. What can you do to save yourself and your loved ones? It's in Chapter 3 of my book. It tells you how to stop the chemicals from coming in and how to get rid of the chemicals that are already in your body that can be causing these kinds of problems. Peer-reviewed studies in children show that leukemia is up 57%, brain cancer up 25 to 50%, kidney cancer up 47%, bone cancer up 29%. Should we be concerned? In a couple of minutes, I'll tell you some places where they've controlled the chemicals and their incidence of cancer has gone down. I thought this was important. Breast cancer chemotherapy, can it hurt your memory? And the answer is yes. These women aren't menopausal and it's not related to estrogen. 66% of women can't remember as well, and they can't multitask, focus, or think as fast as they did before when they've had chemotherapy. In 75% it's temporary. That means in 25% it isn't. What about the men being treated for cancer of the prostate? Are there any studies? I don't know of any, but it would be interesting. Let's talk about fertility. You may all know that infertility is rampant right now. Well, in the 30s, the sperm count was 125 million per milliliter. By the 90s, it had dropped down to 50. At the present time, it's about 25 to 30. At 25 million per milliliter, you're sterile. You cannot reproduce. Why are young men needing Viagra? There are many scientists who have, and the references for everything I'm saying are in my book. There are many scientists now who have published articles saying that men will be, that they anticipate that men will be sterile within 70 years, and I think it's going to take less time than that. The sperm counts are down, the quality of the sperm is down, the testosterone is down, and this is not only in man, but it's in animals, it's in the otters, it's in the beluga whales, it's in the alligators. We really have a problem, and all I can say is they didn't teach me about it in medical school. You can be sensitized by very minute doses in parts per trillion or parts per quadrillion. You can be sensitized in low doses over a long period of time, or you put in a new, nice, smelly synthetic carpet, and it can damage you and your family forever. How do you check for a chemical in anybody? Well, you compare how they look and feel and act and write, and their pulse and their breathing and their blood pressure. Before and after, you expose them to perfume. For example, you take a paper towel, spray a little perfume on it, and you do your baseline first, and chemicals cause trouble within minutes. and within seconds to minutes. And so within 10 minutes, if they can't write, their blood pressure is up, their breathing is down, and they're acting in an unusual way, you've got to understand that that chemical could very well have caused that problem. And there's a good video in here of a boy being exposed to Lysol, and it shows exactly what happened when they were spraying the tabletops at school with Lysol, and then what happened when I brought him into the office and purposely exposed him to Lysol. And then I exposed him to the phenol in the Lysol and showed that the phenol was causing the problem. You should have oxygen available, and there are ways of testing for many chemicals, but not all chemicals. Now, children and adults that have allergies have a characteristic appearance. If you see them doing this, or that means their chest and nose is involved, probably with an allergy. But many of them have dark eye circles, bags under their eyes, wrinkles under their eyes, red earlobes and red cheeks. Abnormally red ones immediately is a clue to you that that person has a dust, bone, food, or chemical sensitivity. And they can get a spaced out demonic look. These children, before they become hyperactive, can become very, they get a look, and it's on this videotape, I might add. They suddenly change in behavior and they develop wiggly legs. There's the allergic salute. There's the nose wrinkle from pushing your nose in the air. There's the dark circles. There's the red ears, and there's the abnormally red cheeks. Allergies and chemical sensitivities can affect any area of the body. Many people have headaches and nausea and dizziness and weakness and learning and visual problems. A year ago, when they sprayed with Anvil, which contains piperonal butoxide, for the mosquitoes here, piperonal butoxide is carcinogenic, mutagenic, and teratogenic. My hand went into spasm like this for about 10 minutes. And I checked with someone I know, and they saw 3 patients that day that had the same problem. These vague neurological symptoms that you're seeing may be due to chemicals. Some of these patients have trouble moving and walking. They have memory and mood changes, menstrual irregularities. You can get cystitis from these things, an irregular heartbeat. I find that there seem to be a lot of people in the city, incidentally, with irregular heartbeats. At one time, we had a gas leak in my house, and I developed premature ventricular contractions overnight. Fortunately, I already knew about environmental medicine. I took high doses of vitamin C and got rid of the natural gas, and my heart is all right now. Had I not known what I know, I think I would be a cardiac cripple, not out rollerblading and playing tennis every day. Things are different. If you have burning of your eyes, numbness and burning of your skin, if your patients complain of that, these vague complaints, don't think it's psychological. They could have bought a new carpet, or they could have been exposed to some chemical in their house. Arthritis, incidentally, if you have someone with arthritis, and they tell you, I go on vacation, I'm fine, and I come home and my arthritis is back within 24 hours. I can tell you there's something in their house that's probably causing it. If they have a leak of natural gas from their kitchen stove, that can very well be the cause of their arthritis. Natural gas from your hot water heater, from your furnace, or from your stove. There's lots of videotapes showing that natural gas, which is hydrocarbons, and these same people might have trouble when they put gas in their car. Chronic hoarseness. If I lecture in a place where they have a synthetic carpet, my voice will frequently get hoarse. And ringing in the ears, again, is another complaint that sometimes you can't figure out the answer. I already talked to you. Probably this is the most important thing I have to say today. If someone is feeling fine, they're bright-eyed, bushy-tailed, they look great, and suddenly they aren't feeling well, someone should say, what did you eat? What did you touch? What did you smell? And if you will start to have them say, what did they look like? How did they change? Did they get red ears when this happened? That gives the parent a clue that they can figure it out. How did they feel? They had a headache or they had a bellyache. How did they write? The writing can change within seconds. Dr. Ray did a study, and he had doctors write with a magic marker, which has a terrible chemical that goes right up your nose into your brain, and in 10 minutes half the doctors couldn't write their name. We're letting children use magic markers and fingernail polish and polish removers. These chemicals are toxic. They go into your brain. The pulse usually shoots way up if you get into something to which you're sensitive. Your whole body goes into an alarm state. Well, I was going to give everyone a present today, and I forgot to bring it in. Mary, can you go get the box in the back of my car? There's a book I wrote that I'll give everybody a copy of. And then the other thing you can check is the breathing. You're blowing 400 on a peak flow meter, the keys are in there, and all of a sudden you eat, and you're only blowing 300. One of the foods could have caused asthma. Don't eat those foods for 4 days, add them back at one at a time, and find out which one's causing the wheezing. You blow 400 when you go to bed, and you blow 300 in the morning, you're allergic to your spouse. But it could be the fabric softener, it could be any number of things, but it's something related to the mattress or the bed. And so your pulse the pulse frequently also will get irregular or very, very fast. I've seen people with paroxysmal tachycardia in the middle of the night, and it's due to chocolate. And the mother had PVCs from chocolate, and the daughter got hyperactive from chocolate and had behavior and learning problems. The same item can affect different members of the family in different ways. Wait, I pushed the wrong thing here. Okay. What do you do if somebody does get in a chemical? Remember that the olfactory nerve is a direct line to the brain, so the first thing they do is stop breathing through their nose, hold their breath as far along as they can, and then run in the other direction. If they can get some oxygen, that would help the brain tremendously. You can I've seen lots of children who have put baking soda under their tongue or in their mouth and stopped a bad allergic reaction. You're in a restaurant, you got into something you shouldn't have eaten. A little bit of baking soda under your tongue will stop an allergic reaction in many individuals in a few minutes. It's a good thing to know. And a few drops of heparin under the tongue also will help. How prevalent are these chemicals? If I did an average and checked everybody's blood, urine in this room, you'd have on an average of 90 chemicals. Some of you would have as many as 500. There are 90% of adults and children have chemicals in their urine and blood, and most adults have it in their fat, in their semen, and in their breast milk. In fact, breast milk concentrates the chemicals in the mother's body tenfold, so that the baby gets a tenfold increased dose of pesticides when she's breastfeeding. Therefore, mothers should be told how to detox and get the chemicals out of their body before they decide to breastfeed and before they get pregnant. This one is frightening. The study just came out in the past week or two, and I've given you the reference. It's on the sheets that I gave you to print out. Newborn infants, they find, have over 200 chemicals in their cord blood. The majority of these chemicals are known to cause cancer, damage to the brains, to affect the hormones adversely, and to hurt the pancreas and the thyroid. Should we be concerned? I think we all have to be far more concerned about what we're doing in our world, because we've got too many things contaminated that are making us sick, that are difficult to cope with. Now, I put a list of these chemicals, but the organochlorides, the organophosphates, the phthalates, the solvents such as benzene are so frequently cause leukemia in children. The PCBs, the dioxin. The dioxin is what the Agent Orange in the Gulf War men. They still have dioxin in their semen, incidentally. And the toxic metals are all problems. You can demonstrate cause and effect relationships easily and quickly with a chemical by merely exposing the patient to it. And you can show that their breathing goes down if they have asthma, or it causes a headache or something like that. There's a book that I'm going to give you that has a 1-week diet in it. That is called The Impossible Child at School and at Home. This 1-week diet, if you have a hyperactive child and it's due to a food, oh, that's the wrong box of books.
We've got those.
Oh,
we should have the right one.
Okay, it's that one. Okay, I have a lot of books in my bag. To get back to what was I saying?
Hyperactive diet.
The hyperactive child. Do the diet. Hand me one of the books, please. If you do the diet in this book, 60% of the patients that write me glowing letters never saw me. They did the diet in this book, or they did the diet in one of the other books that I have. But it's the diet in this book that turned them around. 60% will be about 60% better within 1 week. If you also use an air purifier, you'll raise it up to 80%. If you figure, I keep saying you got a nail in your shoe causing a sore in your foot, the treatment isn't Ritalin. The treatment isn't another drug. The treatment is to find out what's causing the problem. When they add back the sugar, the dyes, but it could be the milk or their corn. It's their favorite food almost always. And in all my books, I give you all these little tips. But this book has a lot of answers in it, and I decided to give one to everybody in this room. There are double-blinded studies that show this. There's a type of allergy testing that I did when I was in Buffalo called provocation neutralization. You put a drop of chlorine or a drop of dust or mold in their arm, and within 8 minutes they're sick, and then you give them the right weaker dilution, and in 8 minutes they're well. It sounds too good to be true. Trust me, I videotaped patients for 25 years. It works. What's wrong with it? It takes too much time and it's too expensive. You're not going to make a lot of money if you do it, but you'll help a lot of people. So I've been trying to find faster, easier, more inexpensive ways to cope. You can show brain image changes with chemicals or with exposures to molds. You can do a brain image and then do it later on. And again, this is on the videotape, Environmentally Sick Schools. You can definitely show changes in handwriting and drawing, and it's in the book I'm handing around. And you can show changes in psychological testing. For example, a simple digit test and that sort of thing. Water. I want to talk about the water. The EPA only checks for 8 organic and 10 inorganic chemicals. The groundwater is 50%. The drinking water is 50% groundwater. And the groundwater contains 74 different pesticides. When they use it on the lawn next door, when they spray us all over the city for mosquitoes with Anvil, they are getting it into our groundwater. And I keep sending reports to the head of the health department telling how Anvil, which is a pyrethrin, is dangerous to people as well as animals. And because instead of spraying this with sprays, there are magnets that produce carbon dioxide, and the mosquitoes think it's a human and they're attracted to it. And they go through the hole into this little trap, and they can't get out. This is what farmers use to keep the mosquitoes and the black flies out of their barns. If you use one of these machines, it cleans up the mosquitoes within a half of an acre. If you use the big machine, it goes for an acre and a half. Why are they spraying us if there are 30 non-infected mosquitoes in a trap? They are going to spray us in this city with Anvil and with piperonal butoxide. Piperonal butoxide is so good that if you spray it on a pregnant mouse, the newborn mice have holes in their brains. Well, what the heck does it do to us? What does it do to a pregnant mother? If you spray piperonal butoxide on breast cancer tissue cells that are rapidly growing, that are growing in a normal rate, you spray them with Anvil, they go wild. Should we be concerned? I think that everybody has to start to pay more attention to chemicals. And as I said, I certainly didn't have any idea how bad chemicals were, and I didn't believe in food allergies either 25 years ago. But fortunately, I've learned a lot in the past few years. 2,4-D, we use it on lawns and golf courses in Sweden. They stopped using it. What do you think they have found? Leukemia and lymphomas went way down. For you golfers, I don't think they like you. They banned Durspan because it's so poison, but they have an exception. They can continue to use it on golf courses. Read the last chapter of my book about Durspan and you'll cry. The good news is that golfers are now becoming aware of the fact that these chemicals can damage them. And I might add, the laboratories that check blood say that the best golfers are just loaded with chemicals. And they're going to start to come out with, have golf courses that are chemically free. The golf course superintendents have more cancer than others, and this is all in my book, Our Toxic World. Atrazine is used all over. It definitely, in rats and humans, causes cancer of the breast, and the blood. Frogs have sex deformities at 0.1 part per billion. This is the thing that people don't understand, is you don't need a walloping dose of these chemicals to make you sick. You can get sick from a tiny amount. In parts per quadrillion, you can cause damage. And many of these chemicals, you take a long lingering bath, the chemicals that are in the water go through your biggest organ of your body. 70% of these toxic chemicals can be absorbed through your skin. So you have to get in and get out. You can't linger any longer. Water, I use reverse osmosis with a carbon filter, and I've given references there. Fluoridation, I think, is bad. It weakens the immune system. It causes heart and genetic defects, birth defects, and there are studies in animals that it causes cancer. I know for a fact that water-softened water contains zeolite, and I've had patients where their fingernails would actually fall off if they took 2 or 3 tablespoons of water-softened water. You have to be careful about everything. Let me see. I don't want to forget this, so I think I'm going to skip to it right now. In the uterus, the babies now float in DDT, PCB, lindane, jet fuel, and flame retardants. That means for 9 months they're marinated in this. And because the cord blood, now that they're using better tests, show 200 to 248 chemicals in the cord blood, it makes me think once they start to check more uterine fluid, we've got problems. Then what happens is the mother breastfeeds, and the chemicals are concentrated tenfold in her breast milk. Then we put on a plastic diaper that contains bisphenol. This is, again, a phthalate that affects the male masculinity. And then we do the sin of sins. We put the formula that's maybe genetically engineered or modified into a plastic bottle and stick it in the microwave. Let me tell you, if any kid can pull through this and come through with a high IQ, they really are a fantastic genetic example of how to withstand obstacles. We have got to start to take care of the next generation, or we haven't got a chance. Aren't you glad you came today? Okay. I want to talk about hydrocarbons a little bit. Headaches, asthma, and arthritis are frequently due to gas and oil and kerosene fumes. And as I said, if you're better when you go on vacation, you probably eat the same food. And you're worse within 24 hours when you're home, there is something in that home causing trouble. And if you do peak flow meters, you have asthma. In every room in your house, indoors and outdoors, you can pinpoint where the asthma is coming from. I had patients who said, the peak flow meter is down when I'm at home, but when I'm in your nice allergy-free office, Dr. Rapp, it goes up 50 to 100 points. I said, you got a problem at home. We checked, and it was a leak in the gas and the hot water heater. There are clues that you can get, and I find if you educate the parents, they'll make you look very smart, because they'll come up with the answers. 87% of schools use toxic chemicals to kill pests in the schools. Of those toxic chemicals, 70% are known to cause cancer, 54% are known to damage the nervous system, and 50% damage the reproductive system. When I was on Oprah and showed the girl that had the blood coming out of her breasts after they remodeled the school, 4 other girls in the same school had blood oozing from their breasts. 12 teachers or something like that developed cancer, and half of them died after they remodeled the school. I don't know why this information isn't more known, and that's one reason why I wrote my book. But as you can see, I'm upset about it. If you use pesticides inside your house, you increase by 7-fold the chances of a youngster developing, any child in your family developing a lymphoma or leukemia by the age of 7 years. Do you know that our federal government recently offered, and fortunately the scientists stopped them, but the government with the chemical industry was going to give all families $970 plus a digital camera if they would allow children from birth to 3 years to be exposed to indoor and outdoor pesticides. What's going on? You know, let no child be left behind. Let no corporation be left behind. We've got to think about what's going on. The more polluted the outside areas, the more cancer you're going to have in that particular area. And Phoenix is very polluted, especially because of all the spraying that's going on. I know the pros and cons of spraying. I've written down some of this. I think that the health department's done a superb job in educating everybody about how dangerous the bite can be, but very few people know how dangerous the spray can be. And I think you have to weigh the benefit versus the potential harmful effects. And on my website, I compare in great detail the signs and the symptoms of each of these illnesses, which can be overlapping, and try to give you more insight. Now, some more good news. There's a website that you can go to, and it's in the slips that I'm giving you. And the website's called The Best Control, www.thebestcontrol.com. On there, it will they will allow you to download a free book that tells you how to get rid of cockroaches and ants and scorpions and termites safely. If you call most pesticide places, they are very apt to use toxic chemicals, some of them even though they say they're perfectly safe. So you have to check on everything. I got to tell you about Israel. Israel, the smart Jewish ladies. I'm Christian, so I'm not being prejudiced or in favor of anybody or against them. The Jewish ladies went to the males that were running the government at the time and said, we believe these chemicals are causing cancer. And they laughed at them, and the women, fortunately, were very assertive, and they said, hey, come on, we want you to stop it. At that time, in 28 countries, the cancer rate was the same in Israel as it was in 28 countries. In the next 10 years, the cancer rate in those other 28 countries went up 20%. They stopped the chemicals in Israel, and what happened? It went down 8%, not up 20%, but down 8%, and in young women it went down 34%. That study is rarely quoted. It's quoted in my book, Our Toxic World. I thought that it's significant that when people in Sweden stopped the 2,4-D, that when women stopped the chemicals that were being used in the barns, that cancer went down. Cleaning, I've got a lot of tips on cleaning, but you can read that on the slip. Fabric softeners and dryer sheets are bad, bad, bad. There are too many chemicals. I've got some nice videos of children that just lost it completely. If you're buying a new home, it smells of disinfectants and perfume and scented aerosols. Watch out. They may have sprayed it with toxic chemicals. Be very wary of synthetic carpets. Oh, I have a video show. Well, I think we can show the video. Let's show the video. There was a whole group of children in this school and teachers that became sick, and I had them take a piece of the synthetic carpet, and we sent it to Anderson Laboratory, and the name is here and the phone number, and we just blew air over the carpet into a cage where there are mice. The mice became paralyzed and died within 4 hours. The carpet had no smell. Should we be concerned? What's happening to the children? And some of the children in that school where they put in this terrible synthetic carpet, their IQs have not, it's 12 years now, have not come back to normal, and they now have what I call chemical sensitivities. If they get near any chemical, they collapse, they have headaches, they're wiped out, they're desperately ill. And this is 12 years later. The school has taken no responsibility, and these children that were the sickest, I don't think will ever be well. The one girl still has terrible headaches, can't even go outside. This is what happens when they put in synthetic carpets, they put in plywood and all these other things. So can we show the video? I'm sorry. The rest of the talk is here, and if you have any questions, the details and the references, if you think I'm exaggerating, are in here.
Laryngitis, fluorescent, any type of upper respiratory infection is what I ended up with. I kept finding my doctor said that he couldn't treat me anymore, that I had to go to a specialist. And this was when I decided to go to an environmental specialist.
Sandra is another example.
That's me when I was young.
Patient can become when they have environmental illness. One whiff of a chemical, a drop of a chemical in their arm, and they can change dramatically in just a few seconds.
Now, keep the volume high. This is perfume.
Tammy, how you doing pretty good? Okay, all right. Lungs, Julie and Grace? Okay, all right.
She develops asthma and she can't breathe if she gets near perfume.
Very tight in my chest. Okay, all right.
This is after one drop of a weaker dilution of the thing that made her sick. Now I'm going to show you a school carpet. I'm going to make her hoarse in less than a minute.
If a person has hay fever due to pollen, no one assumes that that person has a psychological difficulty and they aren't referred to a psychologist. But if a young student or a teacher acts in an inappropriate manner or has an emotional problem related to school, chances are excellent that they'll be referred to a psychologist, and no one will even consider the fact that maybe some exposure within the school, some chemical or dust or molds, are affecting the brain. In other words, some patients, the lungs might be affected and they get asthma, but in other patients, it's the brain that's affected and they act in an inappropriate or a different manner. And to make it even worse, these chemicals can at times even damage the brain, either on a temporary or a permanent basis.
I was told that psychosomatic illnesses can make a person behave this way. Until I finally got angry. I said, look, we've had enough. I said, take a look at me. I've got circles down to here. I can't breathe. I can't talk. I'm flushed. And you're telling me I have psychosomatic illnesses?
She's okay in the summer and on vacation.
This is about one person. This is about children. I teach these little bodies. What about their lungs? What about their respiratory illnesses that can attack them? You better do something. Well, after arguing and arguing, he finally decided to call in an environmental specialist and an air quality.
Just fast forward it a little. There. Okay, now we got to go back a little, I'm afraid. Okay. All right, stop it right there. Now she's going to get a test with one drop of an extract of carpet.
I don't know what it is. I seem to be feeling okay. Doesn't seem to be anything wrong with me or anything. But I guess Mary had a little lamb that streaks this way of snow, and everywhere that Mary went, the little lamb.
One of her problems in school was that she got hoarse.
It was against the rule.
Now you're going to see her get treatment, but it's very fast. I'll show you.
Is this what happens to you when you walk into your classroom?
Yes, this is what happens to me when I walk into my classroom.
There. She just got the shot. Now listen.
Yes. Okay. Always, it's easiest when I recite at home. Mary had a little lamb. Its fleece was white as snow. Everywhere that Mary went, the little lamb would go. They followed her to school one day, which was against the rule. And the children left and begged to see the lamb at school.
So you can see how fast you can turn a reaction on and off by just giving them a different dilution of the thing that caused problems. But the best is it tells us the exact etiology. We can show a cause and effect relation, a reaction. Okay. Okay, I'm not going to show you the mice dying, I think, unless you, can we fast forward it again? I really want to show you the mice getting paralyzed and dying. There's a lady from England that's written a book called Chemical Sensitivity in Children. She's an immunologist. Okay, this is it.
Students and teachers. The adverse effects of exposure to certain carpets can be documented by scientific studies at the Anderson Laboratory located in West Hartford, Vermont. Their facility specializes in evaluating indoor air quality and testing the health effects of various products in relation to laboratory mice.
The use of carpets in schools, particularly in the elementary and younger grades, are suspect because of the tracked in dirt, because of the toxicity we've seen, because of the dust mites and dust mite feces causing allergy problems, because of the fact that they can harbor mold with moisture if they're in a damp, gotten moisture in them. And all those reasons, the fact that you have a high surface area product that is going to hold on to whatever it is it's exposed to, is going to eliminate those fumes and respirable particles when agitated.
Okay, there's a mouse.
Ventilation chamber. A thermometer is placed in the test chamber to ensure that the air is maintained at the proper temperature.
And ready for exposure to the carpet. Let's go.
Next, high-definition microphones are connected above the chamber for each mouse.
The mice actually cry when they're exposed to some of these chemicals and crouch in the corner and their skin goes up in the air. From just smelling the odor coming off of a carpet, that I couldn't smell the other odor.
Then purified zero-grade air is blown over the carpet sample, so this air is forced directly into the test chamber which houses the mice. The mice are exposed to 4 separate 1-hour sessions of carpet air. The respiratory rates are monitored on a graph.
Some of them develop cardiac irregularities and hemorrhages in their skin and asthma-like symptoms and things like
There are
that.
4 channels, each one representing one of the mice. The respiratory rate, channel 1, 2, 3, and 4. And we've already seen in the baseline period some severe pulmonary problems in mouse 1 and mouse 2. We're also seeing some sensory irritation here. What we're looking for is a change in the breathing rate.
Okay, now stop.
Motor damage. A healthy mouse easily climbs a tilted screen. This mouse has obvious paralysis after exposure to the air blown over a sample of school carpet. In the reach and grab test, a healthy mouse holds onto the screen. In contrast, the mouse exposed to the school carpet fails this test. Healthy mice will never remain upside down. They instinctively and quickly turn over. This is called a righting reflex. After exposure to the school carpet air, this exposed mouse is very sick. It cannot turn over. Not all test mice survive 4 1-hour exposures to school carpet air. This mouse died after breathing air blown over a carpet sample which came from a classroom. If these tests with carpet samples have this kind of effect on mice, should we not be more concerned about the potential health risks in children and teachers?
I think about these little people that we teach.
So what I've tried to do is give you an overview, scare you as much as I can. That you'll read over the notes, because in the notes it's very detailed about what you can do with common exposures that you have every day. And hopefully you'll start to ask questions about chemicals when someone comes in that has cancer or some of these things, because the whole family's been exposed and there may be more problems there. And I'm sorry that I had to talk about this subject at lunch, but that's when they let me go. Thank you very much.